It was the issue that led to the government shutdown, tax credits that made health insurance much cheaper. Some families are dealing with higher prices or going without insurance altogether.
Our chief consumer investigator, Zanetta Lowe, explains how many are forced to make tough decisions that medical experts worry could cost lives.
Fewer Americans got their health insurance for 2026 through healthcare.gov, roughly 1 million less than last year.
So I was resolved with the fact that we're just going to go without insurance.
Dennis Cupp is one of them. We previously spoke with him just as time was running out for Congress to decide if it was going to extend enhanced tax credits that made plans and premiums more affordable for people who got their insurance through the marketplace.
It's going to be 180% increase next year for the same exact plan.
The enhanced tax credits weren't extended, which left Cupp with a decision to make.
How have things changed since then?
Well, I'm fortunate. I consider myself very fortunate, but my wife had taken a new job, and it came with group insurance.
Cupp says they were down to the wire getting approval for sign-up on December 30th.
I checked the rates on the day that we were switching over, and my rate was going to go from $608 a month to $2,100 per month.
And insurance agent Chuck Hudspeth explained it's not just people who no longer qualify for subsidies who saw their premiums skyrocket.
I've also got some others where their incomes are very low and they still qualify for subsidies, but their premiums went up dramatically. After this phone call, I'm calling a lady who had a policy last year that was running her about $80 a month. And this year, the premium for that same plan went up to over $350.
So Hudspeth found that client a new insurance company with a more affordable plan, but the deductible is pricey. It went from $0 to $7,500.
So she can afford it, but if she gets very sick, then this plan is going to cost her a lot more money. But she's taking a chance because she's in pretty good health.
Did you have any clients that simply opted to go without their health insurance?
So I had some that managed to jump ship in different ways. And I will probably start getting some cancellation notices because when these large premiums start coming in, not everybody's going to be able to pay them.
So what happens then when folks can't pay, or for those who've already dropped their insurance? One option is what's called a federally qualified health center, places like Christ Community Health Services that care for patients regardless of their ability to pay.
So we have seen an increased demand of patients who do not have insurance or they feel underinsured.
Chief Clinical Officer Dr. Reginique Green says their clinics are already feeling the impact of the loss of tax credits with more cash-paying patients, but the burden, she says, is much bigger.
The hugest impact, if you record it, would be the number of people who are utilizing the emergency rooms because they have either let their insurance lapse or that they are trying to stretch their payments.
Dr. Green says skipping preventative care and prescriptions can be even more dangerous for folks in our community where cases of diabetes, heart disease, and hypertension are high.
My biggest concern is that solvable, preventable illnesses and disease progression are not addressed. They're not addressed timely, and we have poor outcomes. We have needless deaths.
People are going to go without their medicines, and they're going to die. People will die because of these decisions.
There's a renewed debate in Congress about extending the enhanced subsidies, but no deal. Cupp has a strong message for lawmakers who hold the power about health care for millions of Americans in their hands.
Get off your rear and take care of your constituents. We're out here having to make these hard decisions while you sit up there in D.C. On health care that I'm paying for with my tax dollars.
Now, if you don't have insurance and can't afford medication, Christ Community also has pharmacies. We also found 4 local hospitals that participate in a program called Dispensary of Hope. We put a link in this story on our website. Investigating for your news leader, Zanetta Lowe, WREG News Channel 3.
And Hudspeth points out, even if legislation is passed and becomes law, that doesn't mean that people would be able to change their policies this year.